As humans, we have sensory organs such as eyes and ears, through which we can communicate with the external environment. But how is about the bacteria? Do they have sensory organs? No, they do not have sensory organs, but there is some mechanism which is called two-component system through which bacteria can communicate with the external environment. They can sense external stimuli and act accordingly. Bacteria can sense change in the light, change in the temperature, change in the pH, change in the magnetic field, and some chemical changes in the environment. For that, they have two-component system. Two-component system is made of sensor and response regulator. What does sensor do? Sensor can sense the change in the external environment and then send the message to the response regulator. Then response regulator change the genetic transcription and act according to the external stimuli. So with that way, bacteria can sense their external environment. Antibiotic exposure is such change in their environment. So bacteria can learn when they are exposed to antibiotics, they can learn how to react to that situation. In other words, they can sense the exposure to antibiotics and learn how to develop antibiotic resistance. As you all know, when we get bacterial infection, such as throat infection or urinary tract infection, antibiotics are prescribed. But unfortunately, bacteria can learn and develop antibiotic resistance. If the bacteria develop antibiotic resistance, so the antibiotic which are using for the treatments useless. So the disease will be progress. We cannot control them. To overcome such situations, scientists are looking for alternative treatment approaches. One of such approaches is bacteriophage therapy. Before moving on to the phage therapy, what are the bacteriophages? Bacteriophages or phages are their viruses. They can specifically go and bind to bacteria and kill the bacteria. In their structure, they have a capsid. We called it head, tail, and some adhesive apparatus through which they can go and bind to bacteria. In this electron microscopic image, you can see a lot of bacteriophages attached to the bacterium. And what is the phage therapy? Phage therapy is use of bacteriophages to treat bacterial infections. This is a success story. Both of them are scientists. The male researcher encountered deadly disease while they are having a vacation and with multi-drug resistant bacterium. None of the available antibiotics were responding to his infection. Therefore, there is no other option than the phage therapy. Then he underwent phage therapy more than 9 months and finally recovered. And then published book which is called The Perfect Predator. I recommend you to go and see that book. It's really interesting story.